And he was saying we are launching a smartwatch which will do the one the hospital poga venda. They are giving you preventions and precautions.
மெடிக்கல் டிவைசஸ் டெக்னாலஜிஸ் பற்றி நான் படித்தேன் சார். ரொம்ப இன்ட்ரெஸ்டிங்காக இருந்துச்சு. ஸோ இதுக்கான எலிஜிபிலிட்டி என்ன, யாரெல்லாம் இதை படிக்கலாம், இதுக்கான கெரியர் ஆப்பர்ச்சுனிட்டிஸ் என்ன, இதை பற்றி கொஞ்சம் எக்ஸ்பிளைன் பண்ணுங்கள் சார்.
This is a new topic.
Yes,
it will be useful to the students. See, IT industry மாதிரி நம்ம கூட இருந்து பார்க்கக்கூடிய இன்னொரு இண்டஸ்ட்ரி ஹெல்த் கேர். எவ்ரி இயர் எவ்ரி மந்த் ட்ரெண்ட் மாறும். ஸோ நம்ம ஐடி வந்து படித்து முடிச்சான்னு சொல்ல முடியாது. அதுக்குள்ளே இட் குட் ஹவ் கான் டு த நெக்ஸ்ட் லெவல் அந்த மாதிரி. ஸோ வி வர் ஒர்க்கிங் வித் ஹெல்த் கேர் இண்டஸ்ட்ரி ஃபார் த லாஸ்ட் 10 years. I remember there was a program called Pharmaceutical Technology Program, which is production, manufacturing, quality control. Then we said Pharmaceutical Business Management Program. Then we are talking about Pharmaceutical IT programs. Rather, Pharmaceutical data science, Pharmaceutical data analytics, Pharmacovigilance Madri program. Today, there is a huge demand for medical devices. Okay, and medical device normally come, the majority of it is majorly coming from Ireland in a place called Galway.
Okay.
Right? So there is a shortage for people there, and they were requesting, can we have youngsters coming for medical devices? So when we searched, the eligibilities are biotechnology, biomedical, anyone from BPharm, PharmD background, and anyone with a chemistry background, like a chemical engineer or a BSc chemistry also eligible, because they know how to train them, they know how to treat them. Yeah. So medical devices is a new program that we launched, and the first batch intakes are going on. I think it's almost getting full because huge response, because biotechnology and biomedical students were waiting for an opportunity. Chemistry students were waiting for an opportunity. I can give you an example how it all happened.
Okay.
Last time in the trip to Europe, I have a habit of going to companies and asking them, what do you want?
Okay.
And when we are doing this survey, I go to all the companies and meet the HR and say, what do you want for next 3 years? So that we can arrange students accordingly. To my surprise, one company said, I said, India, we have enough of youngsters, and I'm an official trainer for Indian Pharmaceutical Association. We understand healthcare industry. So I said, then he said, 300 to work in Europe and 700 in Bangalore.
Okay.
And they are offering good salaries. In Bangalore, it is 1.5 lakh salaries. In Europe, UK and Ireland, around 3 lakhs and above salaries. I said, what is the qualification? Anyone with a chemistry background.
Okay.
And I asked them, what is the job profile? And he was saying, we are launching a smartwatch,
Okay.
which will do continuous monitoring system of the health.
Okay.
And they are very genuinely saying, health cannot be checked overnight, or health cannot be checked at one time. For example, in the BP normal.
Yeah.
BP if I am looking at my oxygen levels, it's normal. Oxygen level normal. If I am checking my sugar, they're saying it is to be monitored for a time. Cardiology threadmill. So they're saying it should be a continuous monitoring system, then only you'll understand.
Yeah.
So this watch
Okay.
Okay. That chip will monitor all your data, your oxygen levels, your BP, your everything will be taken.
Okay.
Yeah. And 1 week they will generate a medical report. And the medical report will give you a clear picture. For my age is very important. Anyone above 50 will be interested to know how what is my strong areas and weak areas and all that. So it will give you a real picture of your health index.
Okay.
And then they will prescribe or subscribe. These minerals are suggested for you. Okay. These vitamins, these immunities, these proteins. So that vyadhi vandu hospital poga venda. They are giving you preventions and precautions.
Okay.
And they're saying this is our European way of taking care of health, especially after the COVID.
Okay.
So they need 300 people to operate it. And all the backend data can be done sitting in Bangalore. You understand? In the Madri vacancies, we map it and introduce a program, take our students and help them.
Okay.
So medical devices work these kind of vacancies. Okay. So medical devices, the career will be, they will be working on their production, they'll be working on their quality control, they'll be working on their regulatories, etc., and all that. And I think Ireland is starting now. Soon it will come to UK and Germany kind of places. So good that you read it. It's good to tell students that medical device is coming up. It's not only pharmaceutical. Devices are coming up now. And a lot of money, especially post-COVID scenario, a lot of money is invested in devices field, which means a lot of multinationals are doing experiments. Okay. They are today working on what is to be launched in year 2025, year 2030. Okay. Work okay. So youngsters are invited. Healthcare, now you know it's from India.
Yeah.
So I think 10,000, 15,000 students can look for these kind of opportunities in Europe.
ஓகே சார்.
Yeah.
தேங்க்யூ.